Tēnā tātou katoa, good evening. Newshub has discovered qualified and critical medical workers are leaving New Zealand in droves because of anomalies in their visas. It comes at the same time as the government is trying to invite healthcare workers to fill gaps in our staffing. National says hundreds of them are quitting because they're simply on the wrong visa or can't wait for slow-moving residency applications. Adam Hollingworth reports.
Family doctor Paul Jones and his anaesthetist wife, Fleur Harding, have been on the front line of the battle against COVID since they arrived here 18 months ago. But they're packing to return to Edinburgh with their 3 children, sick of being stuck in visa limbo. They believe their residency application has been frozen.
Around February, we had to make a decision whether we were going to lose a good job in Scotland to continue the lottery of staying here, or we take the certain thing and go back to the UK. And so we made the decision for our family to return.
Going to put that in the box?
The lack of New Zealand residency has hampered them in all sorts of ways.
Without that, we don't have the rights to buy a house, we don't have rights to healthcare. It's quite unstable for our young family.
He knows several other essential healthcare workers in the same boat and assumes there are many more.
I'm guessing it's running into hundreds, if not thousands.
Back in September, Immigration Minister Chris Farfoy opened the door to 165,000 skilled migrants, but they had to be on a listed work visa. Essential skills, work to residence or open work visa, not a working holiday, partnership or student visa. That's why nurse Navneet Kaur missed out. She was on a student visa.
It's exploitation. I'm getting panic attacks. It's affecting our mental health now.
Kaur has been here 7 years, but in September was 2 months shy of qualifying as a registered nurse, which would have got her over the line. But now she's planning on taking her boy to Australia when she's over the COVID she says she caught at her workplace, a Tauranga rest home.
Why me? Why I am? I'm skilled. I'm a registered nurse. I spend more than $100,000 in New Zealand just to settle down here, just to secure my kids' future. I'm not eligible. Why?
Newshub has learned of other similar stories, and National believes there are hundreds of healthcare workers caught in similar situations.
I don't care what visa healthcare workers are on. We should give them all residence because we desperately need them.
Many have already left, feeling they've been caught out by the arbitrary dates set last September, while those who arrive after them have been welcomed.
I've been speaking to doctors and nurses who are up sticks and leaving New Zealand because they're watching other doctors and nurses arrive in New Zealand and get residency pretty much when they land, and they've been waiting for years.
All this as nurses and doctors remain in short supply just as COVID peaks.
OK, well, Adam joins us now live. Adam, what does the Immigration Minister have to say about this?
Mitch, the Minister Chris Farfoy says many critical healthcare workers will qualify for residency. An announcement is expected soon. And he says for those who fall outside the 2021 visa allowance, there will be options available. But the trouble is when. And in the absence of a timetable, many are voting with their feet. National's saying simply, let's just give all critical healthcare workers residency now.
Adam Hollingworth, thank you for the update.